Join us now for Health for Life, brought to you by Vitruvian Health, formerly Hamilton Healthcare System. Today we're talking with Dr. Nancy Carnevale of Anna Children's Institute in Dalton. Thank you for joining us, Dr. Carnevale.
Thank you for having me.
Dr. Carnevale is a board-certified child development pediatrician and the medical director of Anna Children's Institute located at 1201 Burleson Road behind Hamilton Medical Center in Dalton, Georgia. She specializes in attention disorders, autism spectrum disorders, behavioral and development challenges, and more. Dr. Carnevale graduated from Assumption College in Worcester, Massachusetts, attended medical school at Brown University in Rhode Island, and completed her residency in pediatrics at the University of Connecticut. She also completed her fellowship at Brown University and is board certified in neurodevelopmental disabilities. Okay, so our topic today is going to be teaching empathy to children, and to young children. And could you explain what empathy is and how it differs from sympathy?
Certainly. Empathy is the ability to understand and share the feelings of another person. It goes beyond simply acknowledging someone's feelings, which is really what sympathy is. Empathy requires us to put ourselves in another person's shoes to really feel what they're feeling.
Yeah, that's a pretty helpful distinction, and it is really about truly understanding someone else's emotions and not just recognizing them. So why would it be important that we teach this to children from a young age?
So there are multiple layers to all of this. First, children are born with a certain level of kind of natural empathy, which can be nurtured or stifled depending on their environment. The sooner we start nurturing it, the more ingrained it becomes part of their character. Secondly, research shows that empathy is linked to many positive outcomes like better emotional regulation, better emotional intelligence and mental health, and just healthier relationships.
You know, you had kind of mentioned the role of environment in kind of nurturing that empathy. How would that impact a family setting that has this?
The family setting is really crucial. It's where children first learn about relationships and emotions, and parents and caregivers are their first models for their children, whether they realize it or not. And children are like sponges. They absorb the emotional tones and attitudes and behaviors that they observe. Therefore, if a parent displays empathetic behaviors, it's more likely that the child will too.
Well, it kind of makes sense because kids often learn from their parents. And so, the saying, do as I do, kind of works out in this situation.
Absolutely. Children are much more likely to do what they see rather than what they are told. And that's why it's so crucial for parents to be conscious of how they act, not just not what they say.
So what could be some tips that a parent should know when it comes to teaching empathy?
So I think the first tip is just kind of what we discussed, that kind of modeling of empathy. So parents, again, primary role models for their children. If you want your kids to understand empathy, show it in your actions. For example, if you see someone in distress, don't shy away from helping or at least expressing some concern for that person.
What else could they do?
So another big thing is just talking about feelings. So it's important to discuss emotions openly with your children. Ask them about their feelings. Talk about other people's feelings. For a young child, you just kind of keep it simple. Kyle is feeling sad because you took his toy. And for older children, you can then expand on that conversation. It's also important to validate your child's really difficult emotions. So sometimes when a child is sad, or angry or disappointed, we as parents tend to rush in and try to fix it right away to make the feelings go away and to protect him from pain. However, those feelings are really just part of life and ones that children need to learn to cope with. So in fact, labeling and validating difficult feelings actually helps children learn to handle them. So for example, a parent may say, "You're really mad that I turned off the TV. I understand. You love watching your show, but it's okay to feel mad." And that kind of empathetic approach often helps children learn to empathize with others who are experiencing difficult feelings. Another thing is it's really important for parents to share their own feelings. It's okay to say things like, "I'm so nervous I have to give this presentation tomorrow," or "I was so disappointed when whatever happened." Children need to see that adults have feelings and how we handle them.
So it definitely seems to go both ways.
Correct. And remember, it shouldn't be like an interrogation of feelings, but more of a conversation. There's another thing we say, kind of using I statements. And I statements, again, is to teach your kids to express their feelings with I. I feel sad when you take my toy. This promotes that emotional intelligence and reduces accusatory language.
It's almost like another language, teaching them the language of emotions.
Correct, exactly. Another thing is to suggest how children can show empathy. For example, let's get Kyle some ice for his boo-boo because he's hurt, or let's bring Grandma some soup today because she's sick.
So those are some pretty good ideas.
So then another tip that we encourage is what we call perspective taking. And it's just like simple exercises like discussing the feelings of a character's story. So when you're reading, ask questions like, how do you think he felt when that happened? Or why do you think the boy is crying in that picture?
Okay, so you could kind of take lessons from stories, from story time, and turn it into a lesson in empathy.
Exactly. It's simple but effective. You can also use pretend play. Talk with the older toddlers about feelings and empathy as you play with them. For example, you might have the stuffed animals or doll figures exhibit some poor sharing or not being nice to each other. And then you can talk about the way that makes them feel. You can use animals, for example. Oh, the dog has his head down. He looks sad. He is so lonely that no one is playing with him.
Are there various other ways we could still encourage children to show empathy?
Well, it's always important to praise that good empathetic behavior. So whenever your child shows empathy, praise them for it. And that will reinforce the behavior and make them more likely to repeat it.
It seems like positive reinforcement usually works in this situation.
It does. Children, just like all of us, respond well to positive reinforcement. So for older children, there's more tools, and teaching empathy can be taught in a school curriculum. There are videos that kids can watch on empathy. We can read literature and watch videos, and the important thing is to try to do that together. And that creates an opportunity to discuss feelings and empathy. Another thing is volunteering. That's a nice thing to do with the older child. The older child can maybe work at an animal shelter or in a soup kitchen.
Okay, so we've been talking about, young children and older children. How could this work when it comes to somebody that's just grown up, some kind of adult?
Well, I think with adults, again, it gets back to we have a certain amount of empathy that we're naturally born with, are part of our character, and then how it's nurtured over the course of a lifetime. So they're going to have a certain amount of empathy. And a lot of it with adults is just knowing how to express it. So a lot of times they feel that empathy, but they don't know what to do with it because maybe they're shy or embarrassed or, a little bit self-conscious. So sometimes they don't really express it in the ways that they could in order to help themselves, in order to model it, in order to help in relationships. But I think it's important for them to be aware of it, to try to express it. And sometimes actually adults need extra help. They may need some counseling or coaching to help them with those kind of things in order to improve their relationships.
Yeah, definitely. It kind of sounds like it should really start all the way back in their young childhood, but sometimes it just doesn't.
Correct. And for a number of reasons. Again, it's whether or not it's nurtured, it's what you're exposed to, and it's all related to your other characteristics. Again, are you shy? Are you outgoing? Or, are you the class clown and how you express yourself? So there are many other factors that contribute to how you express your empathy.
Well, do you have any final words of wisdom for our listeners?
I guess I would just like to say, just don't underestimate the power of empathy in building character. It's just one of those really important skills you can teach. It's a lifelong journey, like we talked about, but one that can really enrich not only your child's life, but also the lives of all those around them.
And thank you very much for sharing all this information with us. And before you go, could you tell us a little about Anna Shaw Children's Institute?
Sure. Anna Shaw Children's Institute is dedicated to the memory of Anna Sue Shaw, and it's a regional leader for the care of children birth to age 11 who experience the challenges of developmental delays. We do therapies for children, including physical therapy, occupational therapy, speech and feeding therapy. Psychological services also are provided, and that can include individual counseling, family counseling, behavioral supports. We do cognitive and psychological and developmental evaluations to try to address each child's individual skill set, and then to identify the therapy or help that they need in order to maximize their development. We have a treatment navigator who's dedicated to support families through the whole kind of diagnostic and treatment process.
It just sounds wonderful that all this is available to families here in our community. For more information about Anna Shaw Children's Institute, call 706-226-8900 or visit hamiltonhealth.com/children. For an appointment at the Institute, please ask your child's pediatrician for a referral.
This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem.
Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.